Hey everyone, it's so great to see you. Some of you I've spoken to but not seen before, so it's lovely to see you here today. I hope you're enjoying conference so far. I'm just going to go through some of the ways in which Ataxia UK works to support the ataxia community. So we fund research into cures and treatments, and we maximise the impact of research activity. And we work hard to try and make treatments available to the ataxia community. We do everything we can to foster best practice in the treatment and care of the ataxias and to improve and speed up the diagnosis journey. We provide information, advice, support and services to the ataxia community to enable people affected by ataxia to have the highest possible quality of life, and a bit more about that in a moment. We share information in a range of different ways, and we provide opportunities for people in the ataxia community to get together online and in person. And we fundraise in a range of different ways to pay for all of the things that we do. We apply to grant funders like the National Lottery. We support the ataxia community to get involved in fundraising events, and we host a range of events. We also receive donations from members of the ataxia community who give generously. So what do we do to work to improve diagnosis and care? We have accredited 6 specialist ataxia centres in London, Oxford and Sheffield, and we hope to open more to increase access to specialist care, and we hope to set up a virtual ataxia centre. We produce medical guidelines for the treatment of ataxias to share with any doctor or health professional working with a person with ataxia. We also have a summary version for GPs. And we have recently employed our specialist ataxia nurse in the southwest of England who is supporting our friends to access quality, coordinated care and treatment and to navigate local services. So the Ataxia UK services team, we've recently said goodbye to Tilly, and we look forward to welcoming her replacement in the coming months. For the moment, though, that leaves Alice, Camilla, Jessica, Sally, Shayna and I, and of course our brilliant volunteers, some of whom are here today, and who we absolutely could not do without. So the helpline is open Monday to Thursday, 10:30 a.m. to 2:30 p.m. Though if you need to speak to us at another time, we can give you a call back at any point during office hours. You can reach us by phone or email, but sometimes people write to us as well, and we can also have video calls and meet with people online. The helpline is operated by Ataxia UK volunteers and staff, and all the helpline volunteers have lived experience of ataxia. And the helpline isn't just a place to learn about the ataxias and Ataxia UK, it's a resource and support hub for people who are affected by ataxias in all aspects of their life. So as well as providing support and information around diagnosis, treatments and living with ataxia, we can help with a range of other issues, including things like welfare benefits, access to grants and other services. There are lots of things we can help with, and if you aren't sure, please get in touch. If we can't help, we will try and put you in touch with someone who can. Sometimes people need a bit more than information and advice, and that's where the advocacy service comes in. So an advocate can provide you with information about a particular situation and let you know what your rights are so that you can make informed choices. They can support you to have your voice heard and to tell people what you want. If you think you might need support from the advocacy service, please do get in touch with us via the helpline. Our specialist ataxia nurse service launched in the spring this year, thanks to partial funding from the National Lottery Community Fund. We're piloting the service in the southwest of England because that is an area with very little access to specialist neurological and other healthcare services, which are helpful for people with ataxia. The nurse works both with individuals and the wider health system, building networks within the NHS, raising awareness of ataxia among healthcare professionals in the South West, and supporting patients to access the care and services they need to live well with the condition. We also have our Rare Conditions project running in Scotland in partnership with Parkhead Citizens Advice Bureau. And the service helps people in the Ataxia community in Scotland access welfare benefits. And they do other policy work, including Ataxia UK helping Ataxia UK to fight for things like cross-border referrals, so that people in Scotland can access specialist ataxia care in England. And that's Lindsay, our Rare Conditions advisor in Scotland. We also bring the ataxia community together at events like this virtual conference and at in-person roadshow events. The next roadshow will be taking place in Basingstoke on the 21st of March in 2026. We keep the community up to date via our quarterly magazine, which arrives in March, June, September, and end of November. We have our monthly e-newsletters and specific e-newsletters relating to things like mavaloxolone and research updates. And of course, we're very active on social media as well. Join one of our branches and support groups. There are more than 40 across the UK. They're all volunteer-led, and most meet monthly or every other month. And quite a few are continuing to meet online at least some of the time. Or you can join our virtual support group or one of our other non-geographical groups. We have a carers support group, an autoimmune and gluten ataxia group, and a 16 to 30s group, and hopefully soon a group for parents of children with ataxia too. If there's no group in your local area and you want to start one, we can support you to set that up. And if you have any questions about branches or support groups, there are details about the groups and contact details for our group leaders on our website. Or you can get in touch with us by emailing us at volunteering@ataxia.org.uk. We host a range of virtual activities, including mindfulness and chair Pilates, which I'll go into in a bit more detail in a moment. We deliver information sessions as well as all about ataxia. We cover other subjects which are important to the ataxia community. And sometimes we do fun activities like quizzes as well. So our chair Pilates is hosted by Sonia Ford, and she's been delivering these sessions for us for, I think it must be almost 5 years now. So she knows quite a bit about working with people with ataxia. The exercises are inclusive and chair-based, so anyone can join in. Class size is limited so that Sonia can see everyone in the class moving on her big monitor screen, and can talk individuals through adjustments so that everyone gets the best out of the session. We do charge a small fee, but it is on a pay what you can basis. Tickets are £1, £3 or £5, whatever you can afford. And it helps to ensure people come along because places are limited, of course. But we wouldn't want ticket prices to get in the way of anyone joining. And we ask anyone that can't afford to pay to let us know, and we will absolutely waive the fee. Some of you will be doing chair Pilates this afternoon. And for those that are missing out, there will be another session hosted online on the 18th of November. And you can find out more and book a ticket on the Ataxia UK website. All About Ataxia Plus uses the same format as All About Ataxia. And that means we bring people together to learn about different aspects of ataxia and living with ataxia, and to share their experiences. So there's information and a video or a short presentation, and the chance to meet in small groups facilitated by our volunteers. We are working on covering a range of topics, including gadgets, aids and adaptations, movement and exercise, and mental health. The sessions are developed by volunteers with lived experience of ataxia and specialist organisations like Rare Minds. And Rare Minds developed the All About Ataxia and Mental Health session, which will be running this afternoon. I've realised I've mentioned All About Ataxia here, but haven't explained what that is. So some of you will already know. All About Ataxia is an online seminar. It usually runs, it's a one-day session. It usually runs from about 10 in the morning till about 2 o'clock in the afternoon. And we show videos that were recorded at the Specialist Ataxia Centre in Sheffield, which give information about ataxia and how to live well with the condition. And then there's that opportunity to break out into small groups, which are facilitated by our volunteers, all of whom have a diagnosis of ataxia. So that's those online sessions. We have speech therapy. We run speech therapy course delivered online via Zoom, so they're accessible wherever people live. The programme combines small group sessions with one-to-one support which addresses individual challenges. And the therapy focuses on building confidence, improving clarity, and giving practical communication strategies that can be used in daily life. Feedback shows that participants feel more understood and less isolated. And this work is made possible thanks to funding from the Gift of Speech Appeal and from McKesson, who made us their Charity of the Year last year and raised a huge amount of money for us, which is brilliant. The other part of our Gift of Speech project is our voice banking service, or rather Speak Unique's voice banking service, which is funded by Ataxia UK for people with ataxia. So voice banking allows people to record and create a personalised synthetic voice to use on a communication device if speech becomes harder to understand. Ataxia UK funds this via Speak Unique, making it accessible without a cost to the user. There are 3 options. There's voice build for people whose speech is unaffected now but may change in the future. Voice repair for those already noticing changes such as slurring or breathiness. And voice design for people who can no longer speak clearly, using recordings or voice donors to create a new voice. And we'll hear a bit more about that from our friend Laura a bit later on. The process is flexible and can be done at your own pace, in your own time. And participants have described it as life-changing, giving back a voice that still sounds like them. Again, as I said, this service is funded thanks to the Gift of Speech. And earlier I mentioned our brilliant volunteers, and you've seen some of the ways that volunteers support the work that we do by running our branches and support groups, supporting us with online activities and supporting people via the helpline. And that's just a few ways that you can volunteer with Ataxia UK. There's training and support provided and some roles that you can do from home. You just need a device and a stable internet connection. So if you want to get involved or maybe you just want to know a bit more about it, please do get in touch. We would be delighted to hear from you. So if you have any questions about accessing any of these services, please do get in touch with us. You can reach the services team either via the helpline or via volunteering, and it doesn't matter which one you use. We can pass you on to the right person if you come via the wrong route, but we would love to hear from you. And that's it from me. So I'm just going to